pediatrics, GMH. So we'll be talking today about the dengue fever. So let me maximize this. I think everyone can see the screen, right? Can see?
Yes, we can see the screen.
All right. So today we'll be talking about the dengue management. So as you know, the dengue is a little bit increasing nowadays. And thank you, Minister of Health team, and then the chosen teams as well. So I'm Faisal from Pediatrics, GMH. So we'll be talking about the management of dengue fever, especially in Maldives. Okay. So as all of you know, this is the vector for dengue. This is Aedes. There are two species, Aedes aegypti as well as Aedes albopicus. So it can cause Zika as well as chikungunya and yellow fever. And dengue, there are, as you know, there are 4 types, 1, 2, 3, and 4, right? So there are 4 types of dengue. So that means actually you can get dengue fever 4 times in your life. Sometimes you will find patients who come with the 2nd time and 3rd time, even 4th time with the dengue fever in Maldives, because it's so common in Maldives. We are talking to you because you are very, very important in managing the dengue fever, because the more, the better you manage the case, the less mortality will be. And even if the patient goes into the severe part, still we can save the patients, inshallah. So it's very important that people at the peripheries in the islands know how to manage the dengue. Dengue is a complex disease, but I would say it's very, very simple to treat, and it's cheap as well, and also very effective. So as long as we know what to do at the right time, at the right thing, then inshallah we can save the patient. This is the same from Tissayakon in 1994. It says actually the dengue fever, the management of the dengue fever, the successful management, it depends on how early we can recognize the patient, whether they are going into shock or not. So if we can pick the shock part, whether they are, the shock can be whether leakage or bleeding. If we can early detect the shock and treat it, then the patient will be safe. If we don't, then of course they will end up with a prolonged shock, and then they will start bleeding, which is quite unsuccessful most of the time to treat these patients. So as we are talking about the management, it's also very important to talk about the prevention part, so that actually everyone knows how to prevent. Otherwise, many times what happens is what is given, the message given may not actually be infiltrated to people. For example, this one, when you are trying to prevent the mosquito breed inside, it's very important not to cover something with something like this, because if you see even these small pockets can have a lot of mosquitoes, so it's not a very good one. So we need to actually guide them accordingly actually. So how to approach a patient who comes with a fever? Of course, one thing is to see whether they have risk factors. So most of the risk factors, as all of you know, pregnancy is one of the risk factors, newborns, those who are less than 1 year, who are more than 60 years, and also who has coexisting diseases like thalassemia, GCSPD deficiencies, those who are on blood thinners like aspirins, or failure patients, or even any other disease like liver impairment, all those. So when you have a lot of cases of dengue, or even if you don't have much cases, you can still do a tourniquet test. So how do you do it is you first take the blood pressure and then you remove it, and then again you go into the inflate the cuff between systolic and diastolic and keep it for 5 minutes. It may not be very easy in smaller children, but it's quite, I would say, easier in bigger children as well as in adults. So you will see kind of these petechial rashes just above and behind the cuff. If you see 10 or more petechia within 1 inch square, then it's most likely dengue. It's very sensitive, about 80% sensitive for capillary leakage in dengue. It's also very important, Modus, to if you have a fever and maculopapular rash, then you also need to exclude the measles and rubella, because we are a country who has eliminated the measles and rubella. So it's very important that we do a good surveillance and make sure that there is no measles and rubella in the country. So what you do is you need 3 things to do. One is notification form. Second is 2 samples. One sample is a throat sample where you are going to use the one that you use for influenza as well as COVID, the one with the liquid for PCR, and other one is serum sample to do IgM. So please send this from all over the country. We need samples to make sure we do a good surveillance in terms of measles and rubella surveillance as well. So when you have a patient with a fever or you suspect dengue, then there are 2 questions you should answer. One is which phase is it? Is it febrile phase, or is it critical phase, or is it recovery phase? In the febrile phase, usually it's around 3 to 5 days, as you know. And critical phase is, of course, then you have, then when the fever goes down, you have this critical period. And then you have a recovery period where when the after 48 hours of critical period, then you have recovery phase. So in the recovery phase, of course, you don't have much issues most of the time. But in the febrile, when the critical phase starts, this is where you have to monitor the patient more carefully, because this is where the patient goes into the shock. I'll come to that point later. The second question is how severe it is, because the severity, according to the severity, you can know where to manage the case. Those without warning signs, you send them home with advice when to come back and what to look for. Those with the warning signs, then you have to admit and closely monitor and do the interventions accordingly on time. Those who are severe, it's not a case for health centers. Most probably you need to at least send this patient to atoll center, original center, or even tertiary center sometimes. So it depends. And also those who has comorbidities like I said, thalassemia, pregnancy, infancy, those you need to admit. And also those who are social, sometimes, when they come from islands, we also admit the patient. So these are the criteria you have to see, and you have to judge the patient, what to give, how to proceed. It will depend on these 2 questions: which phase and how severe it is. This phase, the critical phase, is most important. Okay. So this is the guide that you can see. The pink one here, this is the days. So the 1, 2, 3, these are the days of illness. So once you have fever here, 40 degrees high. So when the fever goes down, you can see when the fever goes down, usually it's down 37.5, 37.2. Then usually it's 40, right? Initially it's around 40. Sometimes it can be biphasic fever. Sometimes there's fever and then it becomes ephemeral and the next day fever. So it can be a biphasic. But once the fever goes down, then starts the critical periods. This is where the patient will go into shock and bleeding. So you have to look actively. You have to look for shock and bleeding, because you need to go to the patient and ask and look, examine the patient and do the PCV and see whether the patient is going into shock or not. So once the patient is going to shock, of course, the one of the parameters, the pulse rate will increase, the BP will narrow down, and when you see the hematocrit, if there's leakage, it will increase. If there is bleeding, it will decrease. This is where the player also starts dropping, and this is the most important period where the patient is to be monitored intensively. Okay. So this is one of our patients. You can see this is the fever chart. You can see clearly, actually this patient has biphasic fever. Day 1, the patient was admitted on day 1, and fever was there, and then become a fever. Again, the fever comes and then it remains for 2 or 3 days, and then becomes afebrile. And you can see actually here, if you see the vitals, this is the BP, and you can see a narrowing here. The narrowing means systolic minus diastolic, right? So systolic and minus diastolic, there should be minimum 20 millimeters of mercury, minimum. So if it is usually the systolic will be remaining okay initially, then the diastolic will increase, making it narrow, and the patient will go into shock. So this is where you have to be more alert and trying to manage the patient more aggressively. The other thing also I would like to mention is this one, the TLC count. So when you do a count initially, especially day 1 or day 2 or day 3, you will see before the platelet drops, you will see leukopenia. So if you have a leukopenia with an undifferentiated fever, please suspect dengue, because you need to repeat the platelet count, because the platelet count may be normal initially. If you see atypical forms of the leukocytes, and it also increase up to 15 to 20%. And once you do it repeatedly, every day you repeat the platelet count, and you will see a drop. So marked drop means the patient actually has a marked plasma leakage, and it is a danger sign. So this is another way to detect the patients who may go into shock. So when the patient comes with a fever, what you do is you will take the history, and you will examine the patient, and you will do some investigation, right? So from you are looking actually for danger signs. So these are the danger signs. You have to one by one, you have to ask the patient whether they have any of these. So one is abdominal pain, tenderness, person vomiting, unable to take oral. So this is telling you that the patient is having going into shock, early shock, poor perfusion in the gut, which is leading to shock. So you have to detect them and then admit. So if you have a danger sign, you admit. The other thing is urine output. They have to pass urine about once at least in every 6 hours. Good amount of urine, not just drops. Bleeding from any side, can be a gum bleed, it can be a gingival bleed, it can be menstruation. There is a heavy menstruation, or it can be a nose bleed, or it can be a melena in the stool, or it can be a fresh blood in the vomiters. So anywhere, any bleed is also a sign of danger sign. Another one is when the patient goes into a febrile phase, usually they will start having they don't get better actually. They get more sick, and then they can have what we call the lethargies and unable to walk sometimes. Sometimes the children are very restless, always crying. So these are also signs of shock. So you have to be very careful. So this also need admission. Other one is of course leakage causing the ascites and pleural effusion. So make sure you also look at these as well. So when you check the blood pressure, make sure you actually calculate the blood pressure. I mean the pulse pressure, systolic minus diastolic. It has to be more than 20. So if it's narrow, for example, usually we have adults, we have 120 by 80, right? So it's 120 by 80 is 40. So if it goes in shock in the dengue, usually the diastolic will increase initially. So you may have 120 by 100. So it's just 20. So in that case, you have a narrow pulse pressure. So that's one sign of shock. The other thing is when you examine the abdomen, you will have a tender hepatomegaly, and of course, when you do investigation, you may find a drop in hematocrit or rapid fall in platelet. These are also showing the danger signs. So these are the ones you are looking for, whether the patient has what we call the danger signs. So make sure that you are looking for this. You're asking these questions before you send them home. If they have any of these, you have to admit the patient and monitor more carefully. So if you don't have a danger sign, for example, there is no danger sign, then of course you are going to send them home, right? So what you do is you will give advice now. You will give advice for them. So once you give the advice, what you do is the one is resting. Of course, you have to ask them to rest. Enough resting is very, very important. Especially this is very important for expected workers. So they need to rest. Antipyretic is only paracetamol, no other drugs, because many people are scared of fever. They will give you on Brufen, NSAIDs, all this mefenamic acid, Voltron, whatever. So this is if you give NSAIDs, then there's a high risk for bleeding. So please advise them not to take anything other than paracetamol. Of course, paracetamol has many brands. They can use any brand like Ufamol, Caldol, Calpol. There are so many brands, but it should be paracetamol. And hydration only ORS. No, sorry, the ORS is very good, but you can use any other. If they start, they can use coconut water. They can use any juice. They can use water, but not so much plain water. It's better to use some salty thing or at least ORS, because sometimes electrolyte abnormalities can happen if there's a lot of water, plain water. If they start vomiting, ask them not to take red colored ones like watermelon, or chocolate colored ones like Milo, or even because once they vomit, you don't know whether there's blood in it. So make sure you also give them this advice. Another thing, also this is also I think very important, but we don't advise much on this, but I think it's very important because we don't want to spread the dengue around in the island or in the home. So they can use mosquito repellents, mosquito nets on the patient, on the patient, because the mosquitoes, when they bite the patient, they can take virus and give to others. So I think it's also very important. The other thing is, of course, tell them about the danger signs. So as we mentioned already before, when to come back is tell them the danger signs about the cold peripheries, unable to take orally, vomiting, severe abdominal pain, any petechiae, any bleeding from any side. So all these danger signs you tell them. So what you do is you tell them the danger sign and then ask them to come back immediately if there is a danger sign. But if there is no danger sign, then they still there to come back after 3 days. So this is very important. So once they, another important thing is, as we told, there are other signs that may not be really, we may not be really thinking of dengue, but it's very common. Sometimes they can be vomiting. They can come with abdominal pain, vomiting, and diarrhea and fever, even in dengue fever. Okay, and they can also come with the seizures. So febrile seizures, they can be associated with the dengue. So please make sure you still think of thinking of this dengue fever still. Okay, and also very important to notify regarding this drug, the paracetamol. Also tell them not to share with others with other drugs. It should be only paracetamol, because many people want to use other people's drugs. So this is another advice. I mean, in more in DVA language, we also give this to patients. I'm sure anybody who can read it will know it. It's in DVA. Basically, what I told in English, the same thing in DVA. So this is you can actually print it and give them, because if you give a printed one, then they can go home, read, or you can share with others, or even they can share in the Viber groups or in others. Okay. You can make a better one if you want. This is just what I have translated. Okay. And so what do you do with it? If there's a danger sign, what do you do? So you have to admit the patient. So once you admit the patient, you don't have to give IFS to everyone in the one you admit, but if they have poor intake, of course, you will give IFS. We usually start with that for adults NS, normal saline, and for children DNS. How much you are starting is 1.5 ml per kg per, very minimal fluid. It's almost half maintenance. And but the important part is, of course, you have to go to the patient every 1 to 4 hours, depending on how severe the patient is, and you have to monitor for temperature. You're looking for a febrile time. So because the critical period. So once the temperature is coming down, then you know the patient is going into the critical phase where you have to monitor them more carefully. Look for the rate. If it is going up, then you know it's signs of shock. Pulse pressure, always minus the systolic from the diastolic. It should be more than 20. Refill time, it should be less than 3 seconds. If they're tachypneic, you know they are having pleural effusions. They can, then you may have to cut down the fluids, and fluid balance is very important. You look for urine output. Always ask them how much they're taken, whether they passed the urine or not. And from the investigation, always look at the hematocrit. If it is going down, you know they are bleeding. If it is going up, you know it's leaking the fluid. You may have to give IV fluids, the DNS or normal saline bolus if it is too much. If it is dropping, you may have to give blood as well. So all these patients, dengue fever, is better to cross match and keep the blood ready as well, especially those who come in shock and those who are thalassaemic. Electrolytes are also important, and of course you will look for the liver function enzymes because they will also guide you whether the patient has severe dengue or not. So this is a chart, just an imaginary chart where you will have this. The temperature is here. So when the fever is going down, actually the pulse rate goes up, and then shock. This is the pulse pressure, systolic and diastolic. Initially, what will happen is systolic is normal. It remains normal, but you will see the systolic is going up, making the pulse pressure narrow. Right here, you can see systolic minus diastolic is becoming narrow and narrow and narrow. So actually, you have to catch the patient here rather than here. So if you catch the patient later, then it's too late to save the patient. But if you catch them here, then you can save the patient. You may have to give normal bolus, or you may have to increase the fluid, or you may have to give blood depending on the PCV. So it's very important chart, this chart. So not all of the patients will, of course, require FS. It depends, and then you have to monitor. Another very important thing is use the ideal body weight, because many patients, especially children, they might be having obese weight. So you can use this formula for 1 to 6 years to see the ideal body weight, because you have to calculate the fluid according to ideal body weight, not the patient's obese weight. For those who are above 7 to 12 years, you can use this formula, and above 12, of course, you are going to use the chart and see the adult weight, ideal body weight. Okay. So ideal body weight is very important. For example, 10-year-old, 45 kg. If you have 45 kg in 10 years, it's overweight. So don't use the 45. Instead, you calculate and see how much is the ideal. And when you calculate, it's becoming 32. And you're going to use 32 instead of 45. Otherwise, the patient will go into fluid overload. And then this is about the maintenance fluid. Of course, for maintenance, you can use the ideal body weight and calculate. Usually we start with 1.5, and according to the PCVs and the patient's vitals, you may have to increase a little bit. But the important thing is, if you're getting more than 1.5, you have to go to the patient every at least 1 to 2 hours and see whether you need to cut down the fluid, because you don't want the patients go into fluid overload. It's very, very difficult once the patient goes into fluid overload. So what is severe dengue? So we are talking about those who are even no danger sign, that is the mild one. Those who has danger sign, these are the ones who are moderate, where you could admit, and severe ones are those who are going to be treated in a place where you can give blood as well. So there are 3 criteria to say that the patient is severe. One is plasma leakage, PCV more than 20% that requires a bolus. Another one is severe bleeding, where you have to use, of course, the blood. And then the third one is when there is organ involvement. For example, if it's liver, it should be more than 1,000 ALT and AST. Or there can be sometimes seizures, a lot of seizures, or even heart failure or nephritis. All these are the ones who are severe dengue. So those who come in shock, what you do is, of course, you have to give a bolus, 10 ml per kg, normal saline over 1 hour. If you have to give another bolus, you may have to give another bolus, depending on the vitals and PCV, of course. And of course, don't forget about calcium and vitamin K. Those who come with the shock, you have to use calcium IV. You may have to give 0.5 to 1 ml per kg. TDS maximum is 10 ml. 10 ml is maximum volume. Vitamin K, again, maximum is 5 to 10. 0.3 mg per kg you can use for OD for 3 days. So also give these 2 if you have a patient who comes in shock. So to prevent the bleeding is the most important, of course. So how to prevent the bleeding is, of course, what you do is you have to prevent bleeding by not giving NSAIDs, by managing the shock early. And also, if they start bleeding, also you have to catch the bleeding early and then treat. Otherwise, the bleeding causing shock will further aggravate the bleeding as well. And of course, the falls, especially from the hospital beds, you have to avoid, and also intramuscular injections. So this is the way to prevent the bleedings. Platelet transfusion is not important in dengue because it can cause more harm by giving fluid overload. Of course, when the patient is having very severe bleeding, then you may try platelet. Otherwise, no. There is no role for platelet. Very important thing is hematocrit. So hematocrit will tell you whether the patient is bleeding or leaking. So if the in shock, look at the hematocrit, you will see a trend of drop in bleeding. If you see a drop, if you see an increase, it's leaking. Also, you will notice if there's bleeding, then you will also notice the TLC actually will rise a little bit than the normal. So the TLC will start rising in bleed. So it's very important in fluid. If you give a fluid, you can give 10 ml package of 2 bolus, or if you have to repeat a third one, better give dextran or albumin, because if you give too much bolus, then they can have fluid overload. This is one of our patients who has gone into shock recently, and when we took X-ray, actually the patient doesn't have much tachypnea and the PCV. If you can see the PCV, also the PCV is here. You can see this one. The PCV is almost same, right? So the PCV also didn't rise much, but when you took the X-ray, you can see it's on the right side. You can see a lot of pleural effusions. So what I'm going to say is, it's not only PCV you have to look for. You have to look everything, the tachypnea. Here we took the X-ray because the patient has periorbital puffiness. So that shows the patient has leakage, right? So in this case, you took X-ray, we took X-ray, and then there was a pleural effusion. So it's very important to see the patient. You have to go take history again and again, examine the patient, check the vitals, see the CRT, see the peripherals, touch the patient, look for the cold peripheries, tender abdomen, look for AINT. All this will tell you, will guide you. The patient is going to leakage. So when there's bleeding, severe bleeding, of course, the PCV drops and you have to give blood, especially thalassemia patient, you have to give blood. So this is one of our thalassemia patient, we are giving blood because we keep the blood ready. And when we need a bolus, it's better to use the blood instead of the normal saline bolus, especially for thalassemia patients. And also another important thing is you should have 2 lines actually, because sometimes when they go into shock, it's very difficult to have lines. So keep 2 lines ready if you because sometimes when you go into shock, it's very, very difficult to get lines. So how to correct the fluid overload? Of course, the first thing is to prevent the fluid overload. Don't use hypertonic saline like isolite. Don't ever use isolite P. Always use either DNS or NS. If you don't have them, you may use ringers like that. That's fine, RLD, but not isotonic, not hypertonic ones like isolite P or N/5. That's very, very hypertonic, or not even 10% dextrose plan. Don't use it. Otherwise, you will have patient with a lot of fluid overload. Of course, then they will have what we call puffiness and wheezing, and all these signs will tell you whether the patient has a lot of effusions, right? So that's what happens in fluid overload. So once you have a fluid overload, what you do is you stop the IV fluids, or at least decrease IV fluid, because if you don't have a good perfusion, or BP is not very good, then you may have to give a little bit of IV fluid, but it's better to stop or at least decrease IV fluid if you see the signs of fluid overload. And also we give furosemide if they are afebrile after 24 hours. You can start furosemide as well, because sometimes they can go into very much fluid overload, and they can cause hypoxia. So you can give oxygen if they have tachypnea because of the pleural effusions, and also stop IV fluids. So it's very, very important that you do that. Okay. And other things, of course, in they're very sick, you have to look for other things as well. So this is one of the patient who is coming into recovery phase. You will see what we call white eye cells with the red islands. So you can see actually white islands in the right seat. So they will have this kind of rash, but it's a recovery rash, and they will have a lot of itching in the palm, in the sole also. So that's very, very important that you recognize them. And this is actually a good sign. Actually, the itching is a good sign. So I'll tell you a little bit of pitfalls and misconceptions that we see in dengue. One is depending too much on serology. Of course, you can do serology, but you should not only depend on the serology itself because of this. So if you see this graph, this is the first time the patient actually has dengue. This is the second time the patient has dengue. As you know, in Maldives, most of the time, by the time the patient is 5 years or above 5 years, they'll have a second infection most of the time. Usually 10 years, they'll have 2 times dengue. So you can see NS1, for example, NS1, this one is the first time. It will remain for 1 to 3 days in the first time, but in the second time, it may disappear or even not appear. So it may not be that prolonged in NS1 in the second time. If you see the IgM, same thing, IgM starts rising a little bit after some time. So you can see the IgM yellow here. And the second time, the IgM may not be there even, right? And in the IgG, of course, it comes late in the first one, but IgG may be late in the second one. So another important thing is if the mother had dengue, and the newborn might already has these IgGs. So the way they present is also different. So it's very important to know the difference between primary and secondary infection when you interpret the results of NS1 and IgG. So don't tell suddenly that if the NS1 is negative, don't tell them, okay, you don't have dengue and you don't worry. But you have to be very careful, look at the patient, see the trend of TLC and platelet, whether they are dropping or not, because sometimes it can be very, very confusing. The platelet count is not important to see the how you manage, but it's important for diagnosis as well as when to discharge. We usually discharge the patient once they are febrile for at least 48 hours with the platelet count is increasing trend at 50,000. So that's the important part of the thrombocyte. And then, of course, another thing is that when it drops markedly, then you know the patient is going to shock. Hematocrit is very, very important. If you see hematocrit is dropping down fast and you know the patient is bleeding, sometimes the bleeding is, you don't see the bleeding, it's hidden, you can't see it. So it's very important to look at the hematocrit, especially when they're in shock. You know, if it is hematocrit is rising, you know it's because of the leakage, you have to give normal saline. If there's bleeding, you will have to give blood. So it will differentiate. And look for, you have to actively look for this severity, because you need to go to the patient and ask them. Very important thing is the fever. Fever is not a danger sign in dengue, but if they become afebrile, then you know the patient is going into the critical phase, especially when they have high fever and suddenly go into 37.5, then you know the patient is entering into the critical period and you have to look for the danger signs. It's very, very important. And the fluid has to be given correctly. And if you are transferring, of course, it's very important to get lines. The lines should be running, and you can have this chart when you're transferring patient from one center to other centers. So I will tell you about some little bit of our cases, some of our cases that we have reviewed the deaths. So one case you can see this patient. This is about death cases. Okay, so you learn some things from these patients. That's why I'm sharing it with you. So one is a 6 months baby who is has fever. So day one brought and there's no other symptoms. I was sent home. On 4th day there is not much fever here, but the patient was brought because of irritability. And then you know this is the way you have to catch. When they have become more irritable, when the fever is going down, then you don't send them home. Okay, please admit. But unfortunately, this patient was sent home, and they were brought again because of they are more irritable now, even inconsolable. So don't send. You have to admit. So these 2 times you have to actually admit this patient. But of course, in the night the patient was gasping and the patient passed away. So at home, actually brought with gasping. So this I just want to tell you here is when the patient is afebrile, if they are not getting better, I mean general condition is not getting better, especially children, you know. They become more irritable. They can't tell anything, just cry. They just cry and become irritable. So please admit them and monitor them more carefully. Get 2 lines and keep them. Very, very important. Another one, death case, 14 years girl who was referred for myalgia. The surgeon was given, the surgeon saw the patient because the pediatrician referred, and then given NSAIDs. And then on 3rd day, the patient was taking NSAIDs. Of course, the fever went down, but unfortunately, the patient started vomiting with blood. So this patient was given NSAIDs and started vomiting, and they came in shock with bleeding. So that patient also passed away. The 3rd case is saw this result and then was told it's not dengue because IgM-IgE is negative and TLC is only low, but blood count is normal. So please, this is very important. So that the first thing that goes down is TLC, not the platelet. So very, very important for you to know that this patient can still have dengue. So it's very, very important. Another case is a 4-year-old who was given too much fluid, because if they're 14 kg, you should actually, if you're giving too much fluid, if you see here, this is almost more than 3, right? So if you're giving too much fluid, here it looks like more than 4 actually. So if you're giving too much fluid, be careful and go to the patient and see when you have to cut down. So every 1 to 2 hours, go to the patient and cut down the fluid. It's very, very important to not to give IV fluids too much. Otherwise, they will have this fluid overload, and then they start accumulating, they become more irritable, and the patient will have breathlessness and hypoxia, and the patient may die. So this patient also died with fluid overload. So it's very, very important to know this. And another thing is, I want to highlight here is, once the parents are complaining, or once the nurses are telling you something, please believe in them, because it's very important, because nurses don't know the patient much. They stay with the patient more. So work as a team, actually work as a team. Nurses and doctors has to work as a team, including the parents, so including the patient. So we have to be in a team. And once they complain of abdominal pain, vomiting with black colors, don't tell them continue same. We have to go to the patient, examine the patient and see what we can do. It's very, very important to make sure this doesn't happen. So that's what I want to share with you regarding the cases. And then, of course, in summary, again, it's very common in molds. And then you had to ask once the patient comes with a fever, especially when there's no source of the fever. Please ask these 2 questions, whether which phase it is, febrile phase, critical phase, or recovery phase. In the febrile phase, you have to actively look for this period, tell them about the danger signs. So other questions, how severe it is. If there's no warning signs, you can send them home with advice. This is the advice you give. If they have warning signs, especially when they're in the critical phase, or when they're entering into the critical phase, if they have a warning sign, if they're not getting better with febrile, please admit them and then monitor carefully. So I hope that got given you some messages, and inshallah together we can actually decrease the mortality of the patients. And here I just end the presentation, so that we can go for a question and answer session, right? Thank you, everyone. So if you have any question, please you can ask now, or you can even write in the chat. Let me see your chat.
Eves soalen etito. Eves tefluk soalen ukurati.
So someone, Dispal has asked about this, any relation to sinus bradycardia, everything. Yes, there is actually well-known, actually it's well-known to have bradycardia, sinus bradycardia in dengue, in the febrile phase as well as in the recovery phase. So it's important because with the fever, you may have relative bradycardia. It's relative bradycardia actually. With the fever, you may not have the typical tachycardia, and also with the shock, even without shock, you may have this not much increase in the heart rate. So it's a very important point. Yeah, thank you. It's a it's a very good question. So paracetamol is the same in other as well as in other drugs as well. So it's 4 gram per day for adults. In children, it is 10 mg per kg per dose. Maximum is of course 5 dose per day. So that is how much is the for the what do you say for the paracetamol. So it's very important to tell them not to take too much paracetamol because too much paracetamol can cause hepatitis. Even now we have one patient who was given a lot of paracetamol at home. So it causes a lot of transaminitis. So even the dengue can cause it, and it can be together with the DF as well as the paracetamol causing this problem. So make sure you also tell the patients about this point as well. Very, very good question. You can on your mic and also ask. Also, you can type as well.
So Dr. Faisal, there's one more question in the chat.
I think the nails, I haven't seen anything with the nails. But if you're asking about the nails, it's mostly due to this hand, foot, mouth. So after hand, foot, mouth disease, they usually come with the nail falls. So they might come with that, but not with I haven't seen anyone with the dengue and nail falls or nail abnormalities. And I haven't read it as well. Haven't seen any. For the hand, foot, you just have to observe. You don't have to do anything for the nails because the nails will come back.
So good afternoon, sir.
Yes.
Sir,
yes, Rao, how are you?
Yeah, fine, sir. Sir, excellent, sir. Your CME is very excellent, sir. Sir, one more just question, sir.
Yes.
In dengue critical stage, how often hypoalbuminemia, sir?
Sorry?
In dengue critical stage,
Yeah.
hypoalbuminemia is it possible, sir?
Yes, it can be there. So usually you have, even if hypoalbuminemia, first correct the fluid. Okay, first correct the fluid part. So you can give 10 ml per kg normal saline, 1 bolus. If it is still proficient, you give second bolus, and then you give albumin. Because in dengue, the very sensitive for fluids. So if it is due to the leakage, always give fluid before the albumin. So it's very important. Even if you give dextran, it doesn't help if you don't give the fluid. So first give the fluid and maybe 2 bolus. Then after that, you may give dextran. If it is bleeding, of course, then you have to give blood. Of course, while you are doing the cross match or you're getting the blood, then you may have to give it just to save this time. But it's better if you have a sick patient or if you have a dengue patient like thalassemia with dengue. It's always better, even if you don't have any others. It's better to cross match them blood and then get them ready. It's very, very important.
Oh, sir. Thank you very much, sir.
Yeah.
Thank you very much.
I'll be in Raitul, inshallah, next week.
Okay, sir. Thank you. Thank you very much.
So, yeah, we'll send you the presentation. It I have given already to Ministry of Health, so they can share it with you. I have emailed it even before. So any other question? Very good questions from your team, I think. inshallah, I think we will be able to manage better. Unfortunately, we have lost one child this year, and also we have one very sick mother who was pregnant, 35 weeks, who was transferred abroad because of the parents want to take the patient. The mother was having encephalopathy. And also we have few cases of encephalopathy. Alhamdulillah, all of them recovered. One in Treetop as well. Even now we have one sick patient in our ward who is kind of encephalopathic. So I think this year the dengue is quite severe compared to, I mean, the severe dengue is more common than the mild ones. I mean, at least we are getting more severe cases. And many of them we have to give blood, many of them we have to give boluses. So far from the numbers, 80% of course happened in Male and Hurmale and Vilimale. Some of them happened in Ariatol. So far I think there are more than 300 cases reported. One death is there. So inshallah, we with more sessions like this, we will be able to save more patients, inshallah. Any more question?
Since there are no more questions, I think it's time to conclude this session. Thank you, Dr. Faisal. It was
Yes.
indeed a very informative session. And before concluding, I wanted to remind everyone to report dengue cases, even if they are suspected case. It doesn't need to be a confirmed case for you to report the case. So I hope everyone will be careful on that. And I have shared the attendance link, which is a Google form, in the chat. Before you leave the meeting, please fill the attendance form. And also I've shared the Google Drive link where you can find all the dengue related presentations, IC materials, which you can use to conduct awareness sessions in your islands. So please fill the attendance form and we can conclude the meeting. Thank you, everyone.
Chat box. Dr. Yahya Buhari. Dr. Yahya Buhari